About half of the patients who come to me for a sleep study say the same thing. I thought I was sleeping fine. They believed they were sleeping well every night. But when they ran the test, we found their breathing was stopping dozens of times per hour, sometimes hundreds. Hi, I'm Dr. Mina Jung. I'm a board-certified neurologist and sleep medicine specialist in Seoul. Today, I'm going to walk you through everything you need to know about a sleep study. What it is, who needs it, what it actually finds, and how it can change your life. And if you're an English speaker living in Korea or considering coming to Seoul for medical care, I'll explain exactly how our clinic makes this process simple for you. A lot of people think sleep problem just means feeling tired. But untreated sleep disorders affect your whole body. The most common one is obstructive sleep apnea. During sleep, your airway repeatedly collapses and your breathing stops, sometimes for 20 or 30 seconds at a time. Your blood oxygen drops, your heart works harder, your heart works faster, and over the years, this is linked to high blood pressure, atrial fibrillation, heart disease, and eventually stroke. In fact, meta-analyses show that people with moderate to severe sleep apnea have about 1.8 times the risk of cardiovascular disease and over 2 times the risk of stroke compared to people without it. If you have hypertension that doesn't respond to medication, undiagnosed sleep apnea is often the hidden cause. Poor sleep also disrupts appetite hormones, making you hungrier and less satisfied with your meals. That leads to weight gain, and weight gain makes sleep apnea even worse. This is a vicious cycle that's hard to break without a proper treatment. And as a neurologist, here's what I want to emphasize the most. Sleep is directly linked to your brain health. While you're awake, your brain accumulates metabolic waste, including proteins like beta amyloids, which is directly linked to Alzheimer's disease. Now, here's the interesting thing. Unlike other organs in your body, your brain doesn't have a lymphatic system to clear this waste. It's basically locked in your skull. So your brain has its own dedicated cleaning system called the lymphatic system. During deep sleep, cerebrospinal fluids flows through your brain and literally washes this waste protein out. And here's the critical part. This cleaning system only works properly during deep sleep. If sleep apnea fragments your sleep, this nightly cleaning gets disrupted and waste keeps building up. Recent meta-analysis suggests that people with sleep disorder may have about 1.5 times the risk of Alzheimer's disease. And in 2025, a Cambridge University study following 40,000 adults found that people whose brain clearance function is impaired had a higher risk of developing dementia in the following decades. So, sleep isn't just about feeling rested. It's connected to your heart, your weight, and your brain. The test that can detect all of this is called polysomnography, or simply a sleep study. It's a complete recording of your body during sleep, brain waves, breathing, blood oxygen, heart rhythm, muscle movements, and snoring, all measured at the same time all night long. One night of data tells us exactly where the problem is and what treatment will actually work for you. So, how do you know if this test is for you? Let me walk you through the most common reasons patients come to my clinic for a sleep study. Number 1, loud snoring and witness pauses in breathing. You probably won't notice this yourself. It's usually your partner who tells you. You stop breathing when you sleep. If you have heard this, don't ignore it. This is a clear indication for a sleep study. Number 2, you sleep 7 to 8 hours but still feel groggy and exhausted. You wake up feeling like you didn't sleep at all. You're tired all day, foggy, running on caffeine. This is a problem of sleep quality, not sleep quantity. And you can't detect it on your own. It only shows up on a sleep study. Number 3, chronic insomnia that hasn't responded to treatment. If you've tried medication, behavioral therapy, and sleep hygiene, and you're still waking up at 3 a.m. every night, there may be another sleep disorder hidden underneath. Sleep apnea sometimes masquerades as insomnia. Number 4, unusual behavior during sleep. Yelling, kicking, falling out of the bed, acting out on dreams. Normally during REM sleep, your brain temporarily paralyzes your muscles so you can dream safely without acting them out. But in REM sleep behavior disorder, that paralysis system fails. And there's why it matters. The brainstem region that controls the paralysis is one of the first area damaged in Parkinson's disease and Lewy body dementia. This can appear 10 to 15 years before the motor symptoms. This isn't just a strange sleeping habit, it needs neurological evaluation, especially if you're over 50. Number 5, a family history of dementia, or concerns about your own cognitive function. This is something we're learning more about recently. Research increasingly shows that sleep quality is directly connected to dementia risk. If you have parents or close relatives with dementia, if you've noticed your memory sleeping, or if you're over 50 and worried about cognitive decline, a sleep study can be a meaningful first step in prevention. Catching sleep apnea or sleep architecture problems early and treating them can help restore your brain's nightly cleansing process and protect cognitive function. What will I actually find out from this test? This is the question that I get often. First, we measure your AHI, the apnea-hypopnea index. It tells us exactly how many times per hour your breathing stops or becomes shallow. That number, mild, moderate to severe, drives your treatment plan. Second, we map your sleeping architecture. How much deep sleep you're getting, how much REM, how many times you're waking up without realizing it. For the first time, you get the answer, why am I always tired? With real data, not guesses. And then, of course, the treatment. The most well-known treatment is CPAP, a small device that delivers gentle air pressure to keep your airway open at night. Most patients are skeptical at first, but once they adjust, almost all of them say the same thing. I haven't felt rested in all these years. And it's not just how you feel. When CPAP keeps your airway open, 3 important things happen. First, your brain finally enters deep sleep properly, which means your lymphatic system can do its cleaning work. That's why patients say their mental clarity improves, not just their energy. Second, the constant emergency response, the sympathetic nervous system being activated every time your oxygen drops, finally comes down. That's why some patients with hypertension actually see their blood pressure stabilize. I've had patients whose family noticed the difference before they did. For milder cases, we can also use oral appliances, positional therapy, or weight management strategies. The key point, you can't choose the proper treatment without a real data. Now, if you're an English speaker living in Korea or considering coming to Seoul for medical care, here's why our clinic might be the right place. First, you'll be evaluated by a board-certified neurologist. I trained in neurology in Asan Medical Center, one of the Korea's top hospitals, and I specialize in both sleep medicine and brain health. I also hold a U.S. Department of Defense QTC designation, authorized to evaluate U.S. military personnel and veterans in Korea. Second, your medical care is fully in English. Consultations, results, treatment plan, and reports are delivered directly by an English-speaking physician. Third, we offer direct billing service to international insurance providers. If you've ever tried to get a sleep study in US, you know the routines. Month of waiting, high deductibles, surprise bills. At our clinic, for most major international and expat plans, we bill your insurer directly. You don't pay everything up front and wait for reimbursement. We handle it. And for self-pay patients, our rates are a fraction of US in-lab sleep study cost, which typically run between $1,000 and $3,000. Fourth, we can do everything in a single visit. In the US, the typical timeline is 3 to 4 months. Referral, scheduling, testing, and then waiting for the results. At our clinic, you can have your consultation in the morning, your overnight sleep study at the same night, and your full results within only a few days. For patients flying in from overseas, the entire process fits into one short trip to Seoul. The most frustrating thing I hear in my clinic is, I wish I had done this many years ago. One night of testing, a few days to results. That's all it takes to change the trajectory of your health in decades. If anything I've described sounds like you, don't put it off. Send us a message in English through WhatsApp or the link in the description. And we'll follow up with everything you need to know, including whether we can bill your insurance directly. Sleep well and take good care of your brain. If you have any questions, please leave comment on the below.